when you call 1-800-GET-SLIM.
We are focusing on your mental health today on Ask the Expert. We have Tiffany Pottkotter here with the answers to some of your questions. Good afternoon.
Hi.
The first question comes from a viewer who says, I'm feeling really stressed with my job and starting to wonder if I'm burnt out. So how do I know?
Well, workplace burnout is an officially recognized disorder in the Handbook of Diseases by the World Health Organization. So what this looks like for you, it's chronic workplace stress, includes exhaustion, reduced ability to complete your task, and just general negativity toward your job. So if you are experiencing these symptoms, talk to your primary care provider and talk about treatment options, which should probably include some mental health counseling.
Okay, that's some good advice there. Another viewer writing, I've been taking Ativan daily for years, and when I switched to my new provider, I was told I couldn't continue it daily. Why can't they just continue the prescription?
Good question. So whenever you switch providers, they actually have the discretion whether or not they want to continue a medication. So Ativan is in a family of medicines called a benzodiazepine. So this is a controlled substance and it can lead to abuse or dependence. So generally research doesn't support the daily use of a benzo. Studies have actually shown that chronic daily benzo use has been associated with an increased risk of cancer or even dementia. So really your provider needs to weigh the risk and benefits of you continuing to take that Ativan or not.
Okay, and another viewer writing in, my friends have commented that I drink too much, but I don't think I have a problem because I still make it to work daily and go to my children's activities. So how do I know?
Well, probably the fact that your people closest to you are expressing concern is probably one of your first red flags. So what does alcohol use disorder look like? It includes unsuccessful efforts to cut back. You're craving alcohol. You can develop tolerance or dependence, which basically means you need larger amounts of alcohol to achieve your same desired effect, and also withdrawal symptoms, which is commonly heard of as a hangover. So it could also include your inability to fulfill your obligations or just continued alcohol use despite having physical or personal issues that were exacerbated by the alcohol. So if you are concerned or a friend's concerned, contact a mental health agency so they can do a formal substance abuse assessment to determine what diagnosis you really have.
All right, sounds good. Some great advice there. Tiffany Pottkotter, thanks so much for joining us. Have a great day.
Thanks.
And coming up tomorrow on Ask the Expert, we're taking your legal questions. Remember, you can always email us your questions. Just send them to news@13abc.com. A big anniversary with Ohio